segment about sex.
That's right, because everybody deserves a happy ending.
And we are here with the expert, Sheva. Thank you for being with us.
Oh, it's always so much fun to be with you.
Well, we love to talk about all of this. And so sex, right? It's supposed to be something that gives people pleasure.
Why does it hurt women sometimes?
So, if it hurts a little bit sometimes, not a big deal, but you shouldn't have pain with intercourse. You just shouldn't have pain with intercourse. And there can be a lot of different reasons why it hurts, but the most important message would be to start with, like, if it hurts, you're not crazy. There's nothing psychologically wrong. It doesn't mean you're with the wrong guy. It just means something's the matter, has to be fixed. And that could be hormonal. It could be muscular. It could be, which in most cases it's muscular, or it could be, or it could be infections or other things like that.
So it doesn't matter the size of the man's package, or does it?
So that is such a great question. I'm glad you asked that. So it actually does matter, but not in the way that we usually think. Okay. So in all my 20 years of being a sex therapist, I can tell you that I've gotten 2 women out of thousands complaining that the package, as you call it, the penis, was not big enough. However, I've gotten hundreds of women saying there's pain because the penis is larger. So basically, the penis has to fit in the vagina, and the vagina is, just so you know, it's not a canal. It's not like the vagina is not a, it's not like there's a space and a hole there like we think of, right? It's potential space. It's like a turtleneck sweater.
Got it.
And you push your head through a turtleneck, and it, slowly opens, and then it pops shut again when it goes through, and it goes around your neck. That's what your vagina is like, and the muscles should be soft and pliable and be able to open up. So if somebody's penis is bigger, it's going to mean those muscles have to stretch harder and more. So, and think of like doing a split, like the difference between going down a little into a split or going way down into a split. So bigger penises can be a problem for women. And that's not to say you should be upset or ashamed. Like, we can always work it out with you, but do not feel like because a penis is smaller that it necessarily is going to be worse for you. It may be much better in your relationship.
So I guess you could say that size does matter then.
Yeah, but the opposite way than we usually think.
I love it.
The poor guys are always like thinking their penis needs to be bigger. And I'm telling you guys, I am just telling you, like, most women are very happy to be with a nice average size penis. So and even a small penis is fine. It's the big penises that sometimes create some problems.
That's too much.
All right, now, is there different types of pain when it comes to having sex? Is there a specific word for this?
There is, actually, ironically, but the words are so crazy. I sometimes think that they create the words to be so difficult that the women won't complain because they can't use them. So dyspareunia is the word you use for pain with sex. And the dyspareunia, pain with sex, can be due to vaginismus, which is usually tight muscles, vulvodynia, which is pain around the vulvar area, or vestibulodynia, which is pain around the vestibule, which is that little entrance.
That sounded like a big tongue twister.
Yeah.
Easy, right? Like, why don't they just call it like erectile dysfunction? Like, that's
exactly. Plain and simple.
Exactly. So I would say most women's pain, and the easiest pain to fix is because of the muscles being tight. The muscles just tighten up because your vagina is just a series of muscles. And usually that's called vaginismus. And it's very, very easy to treat. And it's not a long treatment either.
How long is that treatment? How long does it take to get over that?
Okay, so I love that question. That's like, that's a very hard answer to give. Vaginismus lives on a continuum. Either it could be very tight muscles, let's say that's the y-axis, remember your geometry? And that would be the x-axis, sorry. And the y-axis going up, so up and down would be how scared they are because of the pain. And the pain and the fear work with each other. So if you start putting something in and it hurts, then you involuntarily crunch up those muscles, right? And then the next time you try, it's gonna hurt worse, right? So some women are so petrified that you can't even get near them to help them. And there's a lot of women like that. And some women aren't very nervous at all. And some women have really tight muscles, like really tight muscles, and some women have really not so tight muscles.
Now, are you born with this?
So that is also a great question. I wouldn't say you're born with it, but I would say you have a tendency for it. Like the same way some people have back spasms.
Yeah.
Some women have vaginal spasms. Like it's not voluntary, and these women always feel guilty, like somehow they did something wrong to make themselves get, you know, like, oh my God, I'm so tense. That's not it. It's just some people hold the tension in their neck, some hold it in their back, some hold it in their vaginas. So what we do see, oh my God, look at your faces. I'm like, what we do see is that women who tend to be sort of tense personalities, kind of type A personalities, a little more uptight, they are often the ones who hold their stress in their vagina. So to answer your question, the truth is that if there's not a lot of fear, then stretching out those muscles is not super complicated and does not take very long. And we've had women who come in who 8 weeks later are fine. 10 weeks later are totally fine. We had one woman who was married for 26 years. She had 2 children from artificial insemination. And I think it was like her 55th birthday. She said, like, enough is enough. I'm going to deal with this. And she came in, and 8 weeks later, she was totally fine.
Wow.
Crazy story, right? Crazy story. I remember also one patient who came in who'd been married 11 years. They had never, ever had penetration. Can you imagine? They had other kinds of sex in the beginning, but then she just was so ashamed and so uncomfortable and so upset that she just sort of avoided him. And he had an affair, and that guy got her in the door. And 8 weeks later, she was totally fine. So
if she would have sought out help earlier, all of this would have been avoided.
Totally. And I wish that women weren't ashamed of it, because it looks like the statistic is about 10% of women. That means 1 out of every 10 women you know have this problem. Some have it worse, some have it not so bad, but it's really common. So people should really not be ashamed and get help.
Now, I know that there's some women who have pain the first time they have intercourse, which is understandable because most of us, I like to think, I don't know, you're the expert, will have some type of pain here and there, but then it goes away.
Right, it's your first time, so you don't even know
what you're getting yourself into, right? But then there are other women who, after they have a baby, it's the opposite. It starts to hurt.
Why does that happen?
Those muscles that tighten up they're tricky. Like, we don't totally get why those muscles tighten up. So some women, those muscles start out kind of tight when they start having intercourse, especially, you know, believe it or not, the younger you start intercourse, the easier it is. So, you know, your muscles are more pliable. 15-year-olds have more bendable muscles than 25-year-olds, more bendable muscles than 45-year-olds. So the younger you start, often the less pain there is with intercourse. But then after you have anything that could be considered traumatic to your vagina, to your pelvic floor, like having a baby, as you're heading into menopause or premenopause or menopause, or if you've been in some kind of, I don't know, you were riding a horse and, you know, you have kind of like a little extra jabbing, those muscles tighten up. And so there can be different times in your life where all of a sudden intercourse starts to hurt and you think you're crazy, but you're not crazy. Like, and those are really, really easy to treat because usually there's no fear at all.
I have a question.
Sure.
Say you're with your partner, right, and you're want to like use different like sex toys. Can it happen that maybe you use the sex toy so wrong that it's now causing muscle or vaginal spasms down there?
So the only way that you would use a sex toy so wrong that you would actually cause muscle problems would be if you kind of really abused the toy. Like, if let's say you used a toy that wasn't meant to go inside, you know, sometimes there's vibrators with these like big heads, you know, and if somebody tries to put that in, which is kind of like fisting, are you familiar with that? Yeah, so you have to put a fisting in. So that's kind of big for most vaginas. So, but if you sort of push that in and it goes in and it stretches the muscle too much, then you can traumatize the muscles. Usually things you do are not going to be like irreparable. Like, they just might hurt for a while. I think it's almost like any other muscle. Like, if you were trying to take up gymnastics and somebody like shoved you down into a split, like, oh my God, you know, you can rip things, but usually it's just about muscle being pushed out too much. You know, again, if you overuse those muscles might tense up. You know, you hear people talking about being sore sometimes after their honeymoon because they've just had intercourse too many times.
Is there such thing as too many times?
Only if it feels uncomfortable to you. There's no objective too many times at all. You know, the only reason something would be too many times would be if something's uncomfortable to you, if that penis feels uncomfortable, if you need to do other things in your life and you don't have time.
Now, when they go into the facilities over at Maze, how do you treat this issue of, you know, it hurts when you have sex?
So the first thing to know is that it's like the best thing about coming to us is that we've seen every single kind of pain. And so where women often talk to their physicians and feel like doctors say, I don't see anything wrong, there's nothing wrong, or I don't know what you're talking about because we don't see anything, that will never happen with us. Like, we know what pain looks like, but we know what women experience it as. So we always start with a conversation. You always meet with a therapist first because we're not just treating your vagina, we're treating you. And we want to know where it started, how you feel about it, how it's affected your relationship. Like, all of those things are super important because we can kind of fix the vagina and then you could go back and still feel crummy about yourself, and that's bad, right?
Yeah.
So when you come in, we always have everybody meet with a therapist first. And I never want women to think it's because we think they're crazy and it's in their head, because they've been told that by other people, and that is not the case. But then what we do is we do a full exam, and the medical people at Maze have seen every kind of pain, and they're really good at figuring out what's going on wrong. So they'll do an exam, they'll try to figure out from you where it hurts exactly, what they need to do to put it in. And then there's a number of different ways we treat. Usually we start with something called dilation.
Okay, what is that? I know dilators, dilation, what?
I know, it sounds really scary. It's really low tech and really not scary. It's the best way to get those muscles used to being stretched and having something inside of them. So we start with dilators, and I should have brought some home, but I didn't. But they're sticks. They're like plastic sticks. They're not a pen. That's what this is. But they start at about this size, maybe even a little bit smaller. And slowly with the woman, the medical person helps her insert it into her vagina and see if she can tolerate that. And then she stays there with that until it doesn't hurt. And then she starts moving it around. And then in a week, she builds up to another one, and bigger and bigger until the dilator is the size of a penis. And if somebody has a really big partner, sometimes we work with extra large. We have extra large dilators. The difference in size between them are minimal, so it's really not so scary to women. Okay. And we also work with them to do like relaxation exercises, guided imagery. Sometimes we'll give them anti-anxiety medication if that's necessary. But the idea is to get these dilators through the system, and then now your brain and your body are starting to talk. Like, your brain and your vagina are having a conversation. I can do this. I can get this in. It doesn't hurt. It's going to be okay.
Now, do you recommend people go off and buy something similar and try and do it themselves at home? Or is this something that should only be done with a professional? Yeah.
So truthfully, if you're somebody who had sex and you had intercourse and it never hurt, and now you had a baby or something else is going on, you for sure can buy dilators and try it on your own. If you're not scared and it doesn't freak you out.
Can you tell your significant other to maybe use their fingers and see if that works?
That's a great idea also. Yes, if you have a significant other, right? Not everybody does, but if you have a significant other, they can use their finger or they can use two. That's sometimes scary to people because there's less control over that. Often women would like to start with their own dilators. And also, if you're somebody who had intercourse, then 2 fingers is probably not going to do it, right? You probably need something a little bit bigger than that to get you ready for the penis. And you want to be able to stretch to a size that's just a tiny bit bigger than your partner's penis, because you don't want it to hurt at all when you have intercourse, right? Like, you want there to be no connection anymore between pain and intercourse.
Now, I know that a lot of people sometimes use hormones to treat, the pain, but aren't hormones sometimes bad for you, or like, what's the deal on that?
Oh my God, you asked me the best questions. Okay, so hormones have gotten a very bad rap. It's estrogen in particular, because your vagina is we call it hormonally mediated. It's made up of hormones. it is very sensitive to hormones, specifically estrogen and testosterone, those two hormones. And different points in your life, either birth control pills or breastfeeding or nursing, being pregnant sometimes, after you know, after you have a baby, heading into menopause, your body gets less estrogen, and your vagina is the first part to feel that. So I'm a big believer in people using systemic estrogen throughout the body to replace estrogen. But even if that makes you nervous, and we can have a whole conversation, we could do a whole segment on happy endings on estrogen. But if that makes you nervous, then local estrogen that just is meant to go into your vagina, is very, very safe. And it's usually either a cream they give you or like a little pellet you insert. And that's just, it's what we call local estrogen. It's estrogen meant to go in your vagina. And vaginas are really thirsty for that estrogen, and it makes the tissue softer, and it makes the muscles much easier to like work with. It just keeps it healthier.
With this, is there any side effects once you start taking those? Or
no.
Nothing?
No. The side effect is that your vagina feels a lot better.
And that's what we want.
Exactly.
Does diet have anything to do with this as well? Like, is it what you eat that maybe makes your muscles down there tighter?
Or is it a psychological? Do someone have psychological things that may trigger the vagina to tense up?
So I would answer no to both of those questions if in the global sense. I mean, the truth is that over many years, they thought that people who had vaginismus or tight muscles was because they had sexual abuse. And that it really makes me kind of angry, because that meant that all these poor women who had vaginismus were told, oh, you must have had abuse and you don't remember it, or we need to spend a year digging it out, or let's look at this one thing that happened sort of to you. And, you know, and to my mind, that's really, that's doubly hurting the woman. First, she has pain with sex, and second, you're telling her that there's a problem. So there's no correlation between sexual abuse and vaginismus, none. I do think that there is a relationship between being tense in general. Like if you're tense and uptight or controlling, like those things often, the same people you know who like are just rigid in their body are rigid in their pelvis. So,
right.
You know, that definitely has, you know, a piece of it. But the same way that you can learn to relax, you can learn to relax your pelvic muscle also.
I'm kind of laughing here because, and I don't mean to laugh because it's not a laughable matter, but
no.
There is a saying, like, you know how some people are walking around and, or you're, you know, they say she needs to go get laid.
Yes.
Is that where it goes from?
Yes, except that it shouldn't have hurt her when she was Yes, like I think that there is something about the tension that we hold in our bodies, and I don't think it's bad that you're laughing at all, because I feel like the more we talk about this and can laugh about it, and you know, the better we can all respond to it. Like I think that that's really, if people stop being so serious about all this stuff, we'd have a much healthier world, right?
That's true.
But, right? Don't you think so? You should feel fine about laughing about it. There aren't any foods that I know of that would help, you know, wine, I guess wine.
Wine is always good for any case.
You know, it's a little bit of a funny thing, because I cannot tell you how many patients I've had who've complained to their OBGYN about this, and they say, oh, just relax, drink some wine. They can't do that. Like if they could do that, they would do that. That would be like saying you have a back spasm, take a glass of wine. Like, I don't know if you've ever had a back spasm, but wine is not really going to help much.
Now, as far as the pain, right? So we talked about the tight muscles. Could you have pain from having sex be because you have low lubrication, like you're not wet enough?
Absolutely, for sure. Those aren't usually the women who come to me, because usually they figured it out and bought lubricants.
Right.
And that's a really easy thing to solve. The only thing I will say is that sometimes people have this idea that if you're not lubricated, you're not turned on. And that also is a myth. That's not true at all. There's some people who are just have much moister skin, have more tears in their tear duct. They also tend to have more lubrication. But if you don't have lubrication and you still feel like you're turned on, you want to have sex, then just get yourself lubrication. There's great lubes out there. There's flavored ones, so people can, you know, people like want to play with their lubes. That's great, and it can help a lot, but it doesn't help some of the more severe problems like vaginismus or vulvodynia.
Now, when it comes to vaginismus, when it comes to the guy, how much does it affect the male partner when their female partner is just not getting any joy of it?
Yeah, she's
how do they go through the process of helping out their partner?
So the most important thing I would say to a guy whose girlfriend or wife or something seems to be having pain with intercourse is two things. One is, don't make her feel bad about it, because it's not something she's doing on purpose, and it's not because she's not trying. Encourage her to get help. So that's the first piece that's really important. And the second piece would be, don't stop having sex, because you know and I know there's a lot of other great ways to have sex. And so if you are having sex with your partner and for a while you're just having oral sex, using your hands or whatever other things you decide to do, and then you fix the pain, it's really easy to put intercourse back into the mix. But if you kind of totally like separated from each other and you're not touching each other, then it makes the whole thing really miserable and awkward and unpleasant. So one thing is get help her get help. Two is keep having sex, just not intercourse. And then the third thing I would say for the men is that sometimes if you're early in a relationship and the woman has a lot of pain, the guys have problems with their erection sometimes. So if that's the case, it's not you, it's not your fault. Go have other kinds of sex, really go back to having other kinds of sex, fix the pain. And when you're back to having intercourse again, you know, you might want to use a couple of times Viagra just to keep, you know, feel confident that you're not going to hurt her and it's all going to be okay. And that's not the terrible thing. And like everything else, like if we don't make a big deal out of these things and we help people solve them, the road gets really clear down the way. It's when all these other problems are popping up. People feel unloved, insecure, they separate, like that's when things get to be a problem.
Does wearing tight jeans or tights have an effect to your vagina to the point where it could cause vaginismus?
Tight pants are not going to cause, it's certainly not going to cause vaginismus. It's not going to cause your muscles to get tight. It may create other kinds of pain, like abrasion or something like that. But if you have another condition called vulvodynia or vestibulodynia, sorry about the name, you know, where there's really like, you know, there's burning and itching and irritation on the outside of the vulva or kind of right in the inside of the vulva, the tight pants can really make that really uncomfortable and make it burn much more. So sometimes you may want to not do that, but you should get help for fixing that too. And that might be some of the dilation we talked about, but it could also be hormones, lasers, there's other ways. That's a more complicated thing to fix, but it also can be addressed.
Okay. You mentioned something, this is way off topic, but laser hair removal down there, is it dangerous? Could it have side effects for the vagina or no?
Not if it's done correctly, but I would suggest that you go to a medical place, not like a cosmetic place, because it is touching a part of your body that's you want to take care of.
When you have yeast infection, there's some people that have yeast infection and don't even know it. Can that hurt? Could that be one of the reasons why having sex hurts?
Yeast infections usually don't hurt so much as they itch and they burn a little or they smell funny. Usually, you know when you have a yeast infection. It's very unlikely that you don't know that you have a yeast infection, and you should get it treated. It's not good to leave an unattended yeast infection. That's not.
Should you have sex if you have yeast infection?
You have intercourse. There's a lot of other ways to have sex.
Right, intercourse.
I think you can have intercourse if you have a yeast infection, but a lot of women don't want to, just because it doesn't feel good. Like everything just feels itchy and yicky down there. So probably deal with the yeast infection first, and then move on.
The same thing I can imagine with urinary tract infection.
A urinary tract infection is really usually very painful, and people do not usually want to have intercourse or any kind of sex or anything touching their vaginas when they have a urinary tract infection. So for the most part, I would say don't have sex when you have a urinary tract infection.
Some women have a lot more cramps or, you know, stronger cramps than others when they're on their period.
Right. So some women, their vagina becomes much more pliable during their period. Like some women, when they're dilating, they're using dilators, they say, should I do it during my period? And we say, if you're okay with it, you know, put a towel down under you or something, but so you don't get blood on your sheets, but it usually makes the muscles very soft and pliable, actually. So, and there's really nothing wrong with having intercourse during your period, but some people just are grossed out by it, or their partner is.
So basically, to sum everything up, if you're having pain during intercourse, don't feel bad. It's actually a lot more common than what most people think, and it's treatable.
That is, I could not have said that better myself. Like, that is actually the reality. And don't let it go, because if you let it go, it creates all kinds of secondary problems that nobody wants to have. So
is that where the saying comes in? If you don't use it, you lose it?
So that is part of the way that saying comes in. And I really believe in that saying. Like, if you don't use your vagina, then it gets atrophied. It doesn't have blood flow in it. It doesn't have, things aren't, the muscles aren't working. The nerve endings aren't firing off. And it sort of shrivels up. So you can get it back, but then you have to kind of work on it. It's like if you didn't use your arms. You know how when you have arms in a cast for a long time and then it comes out and it's all like white and hairy and so your poor vagina, it needs you to use it and love it and take care of it.
Exactly. So that's why we want all of our women to enjoy having sex, to use it and feel that pleasure, because at the end, everyone deserves a happy ending. Thank you, Sheva.
Thank you guys so much.
So for more information, you could always visit mazewomenshealth.com. Follow them on their Instagram at Maze Women's Health. And of course, you could follow Dr. Sheva. It's spelled at Dr. Sheva.
Thank you guys so much. I think it's so amazing that you're opening up this conversation. I think it's a conversation people have to have.
100%, because, sex is a part of life, something natural, and you shouldn't feel ashamed about it. Till then, we'll see you next week. Thank you.